Okay, so and we are live. Hi everyone, welcome. So today life has been a sprint, just sprint or a marathon, like back to back. Because all of my guests they just happen to be free today, and it was very short notice. Everybody has been so kind. Like I think you guys are the reason why my delivery just kept on increasing. Like I can't do it because you guys were like so kind. Okay, I'll be there, sure. Thank you guys so much. By the way, guys, we have Dr. Joy. Dr. Joy is joining us now for this session, and we're going to be talking about her takes really on this matter. So before we go ahead, Dr. Joy, please can you call out your Instagram handle?
Sorry, I didn't hear that. Can I?
Can you call your Instagram handle?
Oh, fixed in bloom. Fixed underscore in underscore bloom. I'm actually almost not active on Instagram, but yeah, that's my Instagram.
We have what platform are you active on?
LinkedIn.
I okay, you can find your LinkedIn. So we'll do LinkedIn for this section. I'm also very more active on LinkedIn than I am on Instagram. I don't
Okay.
know how people do Instagram. I don't know.
Watch stuff like I'm never posting anything. I just like watch stuff and leave.
Okay, so I'm going to send you a message right now. So you can just drop your LinkedIn profile in
Right.
the in-call message, and yeah, we'll get started.
Okay.
Guys, give us a minute. Let's let's fix this. Okay.
Hello. Yeah, I'm still with you.
Yes, I can hear you clearly.
Okay, good.
Okay.
I was trying to type in my LinkedIn, but it's just really my name. Just DJ.
Oh, I'm not Yoruba, so that name is always like
Yeah, yeah,
I'm trying
yeah.
to bite my tongue. But yeah, Joy Adig
I
said,
think
did I get that right?
yes, yes, yeah, do it.
Okay. Okay. All right, guys. Yes. So it's up. Okay. Yeah. All right. So we'll get into it in proper. Thank you again, Dr. Joy. Thank you so much for joining us. Before we even get into questions, do you mind introducing yourself? Tell us what you do.
You. Yeah, hello everybody. My name is Joy Ashekweolu Adegbite. Medical doctor, direct residency in community medicine slash public. Yes, I'm resident doctor in community medicine. My job is essentially preventive medicine and providing primary health care in community. So I'm usually working in the primary health care center, and you find me in any preventive medicine program, any public program, like family health education and promotion. That's that kind of stuff.
Okay. So I don't think I don't know if it's
Hmm. I lost you. I can't hear you now.
now I can't hear you again at all. Can you hear
Okay.
me?
Yes, I can hear you.
Can you give like a thumbs up if you can hear me clearly?
Yes, I can hear you now. I lost you for a bit, but I can hear you now.
Okay. Then it's definitely my network.
Okay. Yeah, I can hear you now. I can't hear you anymore. Hello. Hello, can't hear you anymore. It's frozen. Okay, I still can't hear you. Okay, I'm fixing it. Okay.
You can hear me now, right?
Yes, I can hear you now. Yes.
Oh, see, I like you guys already know the drill. The network issues that I'm battling with, God will save me and help me, really. And I think it's general because every other person is just complaining. Uh, and it's even more frustrating because I work remotely. But
Oh, sorry.
we move. Okay, so thank you, Dr. Joy. Thank you again for joining. So we'll get into it because I know you're still in the hospital and emergency can come.
I have lost you again. There's no sound. Uh, oh, good. There's no sound. I can't hear you. Sorry. Hello. I still, yeah. I know you're talking, but I can't hear you. Are you sure you're not muted?
Can you hear me now?
Yes, I can. Okay, great. I can hear you now.
I promise you I was not muted. I just
Oh,
cannot use my laptop for sound, right?
oh,
It has anytime I go on like calls, the sound just becomes really muffled. So I have to use like another gadget as a mic and
oh my God. The sound is off again.
you still cannot hear me.
Okay, now you're back. So you went off and then now you're back.
Oh. Hey, hey, Dr. Joy, there's fire on the mountain.
How we go? I can see your mouth moving. It just goes off. I can't get anymore. But yeah, let's keep trying.
Okay, how about now?
Yeah, I can hear you now. I can hear you now.
Okay, you can hear me now. Now it's better.
Nice.
Oh my goodness, guys, please pardon me if you're watching. The network issues is
Also,
a big
yeah, just really.
it's just so frustrating. But yes, my question was I was asking that for someone that has gone through abuse, right? That has experienced abuse, what is the very first thing they need to do medically?
What's the what's the for someone who has gone through abuse? What's the I didn't hear that.
I don't think I can hear you any longer.
Okay.
I don't
The,
think I can hear you.
the question again. Uh,
I don't think I can hear you. I don't know if you can hear me. Sorry, can you hear me now? Is it better? Is it better? Uh, So I'm not sure if this is my network or her network right now. Let me try to message her. Oh no, I don't think. Hi, Dr. Joy, please can you hear me? I think it's her network that has gone off. Trying to message her.
Because I'm a doctor, I'm going to speak from physical abuse and sexual abuse because that's typically, and sexual abuse really, because those are the areas where we actually come in. For sexual abuse, let me start from there. I would need the person to say a rape or sexual assault. I would need the person to get to the hospital as soon as possible. Say the sexual abuse is rape, we usually encourage that victims would come to the hospital not later than 72 hours. So within 72 hours, within 3 days, preferably. But medically, most of what we can do is most effective when the patient presents within 3 days. So in the case of rape, we want to administer emergency contraceptive because I mean, if one is raped, we don't hope that or we don't expect that the person would get pregnant, get pregnant from the rapist. So we want to give emergency contraceptive, and that's most effective within 72 hours. Most effective within 24 hours, but not later than 72 hours. So there's emergency contraceptive to use. There's also some people are gang raped. So there's um, prophylactic, post-exposure prophylactic drugs for HIV and other STIs, particularly HIV. So, for instance, if you suspect that the rapist is HIV positive, might be HIV positive, we want to give the victim. It's called post-exposure prophylaxis, but it just means drugs to make sure that the person doesn't get HIV, even if the perpetrator is HIV positive. So those are like the most important things that we want to do, and then psychological support as well. I think a psychological support is more effective when it's immediate, when the support comes immediately, as opposed to when the event has been for a while and the person has suffered psychological impact over a long time. So early presentation is what I would say is very important. It's hard, and our community doesn't really encourage people opening up, you know. But medical is just best to come as soon as possible. Physical abuse as well. Physical abuse as well. People, get beaten and they think they just have physical injuries, but then sometimes the injuries are internal.
Yeah.
Some very serious beating. Yeah, so it's just helpful to come early to try as much as possible despite the pain to come to the hospital as soon as possible.
Trust, as you were speaking, you kept mentioning come to the hospital as soon as possible. But there are some scenarios where even your um, abuser, right, is not even allowing you go to the hospital, or you can't even leave the house if it's your partner, or you are just like really physically not able to go to the hospital. What does emergency care after abuse? What does it actually involve? Like in real life that you can easily use? What can you take at home? Uh, uh, I don't know. Like, what would you say would be like emergency? I can't go to the hospital right now. I would go, or what do I need to do? Like immediately.
Right. Immediately, say for sexual abuse, I think you still have to, a victim will still have to leave the house. What I've found is, okay, so one, if it's physical abuse, you want to call for help. Even if you cannot go to the hospital, let somebody know that this has happened. Maybe they can come to the house to help. I don't know if there's any functional emergency line in Nigeria. That would have been the best thing to do. What I found is, some women come to the hospital. So there was this, sorry, just a moment.
Okay.
Sorry, that was the solar making noise. Okay. Yeah, so I was saying sometimes I find that what some victims do is they come to your stool under the pretext of something else. So I've seen a patient come in. She even came with her husband. Apparently, she had been a victim of intimate partner violence, and she came, complaining about something else. And he actually really took discernment, or asking further questions to realize she had been a victim of intimate partner violence. She just came giving symptoms like,
Wow.
oh, it's malaria, oh, blah 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 blah. And then I just asked the husband to excuse us. And the husband was so, pretending to be lovey-dovey. He came in with her into the consulting room. That's what I just figured. And then I just told him to excuse us, and then we were able to get to the root of the matter. And then because of how our culture, our society is framed, we have to really do everything very discreetly. I have to write my number on a paper. We just have to be really discreet, because if you take it up, she's going back to that same man. And she's already saying,
Exactly.
if you knew that that was what she told me, of course she's probably going back home to another round of beating. Yeah, so I find that women come under the pretext of something else. I'm going to just do because I feel like I'm feverish. They don't say that they are going because of that. So I think that
Yeah.
works as well. At least in practice, people would come in under the pretext of something else. Then some of them don't even go straight to the point to say, "Oh, this is what happened." It's really just, I expect that a good doctor, after a while, you just ask more questions and realize, this is likely what is happening.
So I really don't know why our culture is like this. Like, why do we shame the victim and not the abuser? Sometimes you hear things like, "Oh, my husband beat me." They will ask questions like, "What did you do?" Like, what is wrong with us?
Yeah,
Or you were raped and someone is asking you, "What did you wear?" Like, excuse me, there are pedophiles that are sleeping with children. What did the children wear?
it's totally crazy. I think it's a problem. It's a problem with our socialization. If you think that, it's not even just the perpetrators that think that way. Some women come in and they're like, "Oh, he beat me, but me to have my, I made him angry." Blah blah blah. And yeah, it's like I said, it's a problem with socialization. I was going to say it's a problem with patriarchy, because if you think that you're,
I think so. I think you are definitely correct. It's a problem.
if you think, if you think that you're superior, if you think that you're better, then it makes sense to also think that you can do and undo, or you can, subdue by by violence. So sometimes we want to help, and women are saying no. It's okay for him to do that. I am the one that made him angry, and it's just really hard to help them, because you're like, oh well, if you don't think that something is wrong, then it's very hard to help you. And then the cultural and societal expectations that women should remain in marriage. You tell some women, why don't you leave? And they're like, oh, my children. Sometimes it's economic factors. I just saw a woman
Yeah.
about a week ago. And so now when I see a woman and her symptoms are not adding up to anywhere, I ask about her marriage. That's like a principle for me now. Like when a woman comes in with this, the symptoms are not adding, like she's just complaining, her complaints are not adding up. I typically would ask about her marriage. So this woman asked her about her husband, and then she was like, "Oh, that he used to beat her, but not anymore, because now he's lost his job and she's the breadwinner." So he's like, maybe respect, at least for now, he's respecting the fact that she's the breadwinner. And then once that one time she had to get a restraining order from the police station, so that now he's not troubling her again, but that then he used to beat her and all of that. And I'm like, why did you stay? She's like, oh, because of the children. So we find that as well. Sometimes you want to even intervene, but patients are like, oh no, I'd rather keep my marriage. I don't want anyone to say I'm washing my dirty linens in public. All of that.
I think we need to normalize that you are not the problem, right? The people, right, the abusers should be the ones who are supposed to hide their face, and not you, the victim. I don't even know what is wrong with like our society, right? And most times it's because we've looked at it as a normal thing now, a normal thing. So you remember I told you that one. Can you hear me?
Yes, I can hear you.
Okay. So you remember I told
Okay, now I cannot hear you. Now I cannot hear you.
don't talk, keep quiet. And you hear advice like, now so we said they oh, now so we said they
Yeah.
and like
Endure. Oh God, that's how all men are. All those things. Everyone get you.
it's just the generation of, it's like we are recycling.
Trauma. So I've lost you again. I can't hear you.
Again, can you hear me?
Yes, I can hear
Can
you
you hear
now.
me though?
I can hear you now.
Okay, the network is going off, but we are having a very good conversation. And whether the network likes it or not, we are going to have this conversation.
Right.
So I was just saying that it is almost like a pattern. We keep on
Mm.
going round and round. But whatever you know what my fear is. Whatever you don't put a stop to, let it to your children.
Right. Yeah, there's that as
And
well.
so that is why it was very important for me to do this. It is not perfect, right? I mean, look at all the glitches, but I must talk. It is important we start talking,
It is.
because
It is.
I do not want to see things like this in my children. It's not going to happen, right? So this is not. It's about time where we start saying that, oh, I'm not interested in this matter. It's not. This matter is very, it's very controversial. There are some things that I would pick. There are some things I would not pick. And so when I was looking for people who would join me in this conversation, and I spoke to somebody, and she was like, I don't want to talk about issues like this. I understand where she's coming from, but I also was telling her that you have to start talking about things like this. I know that it is very sad. I mean, there is another girl now that we are seeing online, that the cousin killed, right? Because the policeman just felt like it was okay to release him, and he went to just kill the poor girl, right? After assaulting her for years, after raping her for years. But all these things are very annoying. When you see it, you get so worked up and you are vexed, right? But we'll keep on seeing these things every day, every day, every day. Change comes when you talk about it and keep on talking about it and keep on talking. I'm so upset about this thing. Then who will?
Yeah, right. Yeah, I think we're not angry enough until we start speaking and doing stuff.
Exactly, exactly,
It's not
exactly. And
just angry in your heart. You're not doing anything.
you, we have to. So I want to move to the next question and ask questions relating to her marriage. So what injuries or what signs do health workers look out for when a survivor is walks into a hospital or a clinic?
Right. So in my experience, it's mostly been um first from their demeanor. A woman who is not looking straight into my when you ask about, in short, in the conversation, there's always a reduction in self-esteem with the survivors, with women who experience gender-based violence. You're talking to them, they are not looking into your eyes, their heads bowed. But typically, what you complain about is, in my experience, two things. It has been body pains, and did you fall? Any fever? There's nothing like that. Body pains, and then there's palpitation. So palpitation is your heart is beating fast for no reason. Yeah, so typically body pains. Typically body pains. Pains. That did you fall? And then some of them would even give funny reasons like, oh, something just happened. I just stressed. I'm just stressed. or I did something stressful. But these days I just, I don't take that anymore. Any I fell, any I stressed myself, any is just malaria, and that's why I just really want to ask for that. And then sometimes they come with their partners, and you can tell, they are you can almost read fear, you know, you can almost read fear. So usually I don't see women with their partners anymore. I don't see women with their
So one of my
now,
one
I don't want to assume you're in a loving relationship. Just stay outside.
at all. We are not assuming. We are not assuming because
Yeah.
guess what?
Some men, because because it's also not common. You would assume that if a man comes with a woman to your hospital, then it means that, oh, they're in love and all of that. I don't make that assumption. And ideally, confidentiality, I should be seeing my patients alone. So, sometimes the men will say they want to stay, and staying means that one cannot say what she needs to say.
She
So,
cannot say what's on her mind. Yes,
like,
exactly.
no, 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 no. Please.
And guess what? Even the most loving husbands are the ones that are even doing the most times. They are the ones that are really, really, doing really terrible things to them, and they just hide in disguise of, oh, I'm a loving
Yes, yes,
husband and I'm so
yes.
romantic. Please
Mm-hmm.
don't be deceived.
And then sometimes their presence is not out of love; it's out of control. So the women,
Mm,
they can't go anywhere themselves. They are policing their phones, where they go to. It's just really crazy. And then sometimes when there's also economical abuse. It means that even if the woman comes to us, so she can't pay abuse herself. So the man has to follow her. And then I'm
this
sure
is so.
somebody would say, why are we saying women for gender-based violence? But the truth is, it's just really mostly women that suffer these things.
Exactly.
I know that some men get beaten by women, but yeah, it's
Yeah, according to the data, I don't think that
men are the
in the wrong, but because according to the data, it shows you guys respond quickly to someone who comes in that has experienced violence, any form of violence. How would you say in terms of the way you're responding to them, how quickly the medical attention is coming? How would you rate yourselves? Like, be honest.
right. I would say that despite our best intentions, our response is limited. Okay, so let me give an this was another colleague telling me what happened at the primary health care center. Actually, this one I'm in right now. A woman who had experienced, I think, physical violence came to the hospital, told us what went wrong, told them what went wrong. They were going to manage, and I think after a while, the man came in drunk and started shouting and threatening to beat everybody that takes care of her. And then sometimes women don't even open up to that. Or sometimes they open up to it, but they're the ones also insisting that, again, this is years of socialization. So that's what healthcare workers. I mean, the fact that you're a healthcare worker doesn't mean that it doesn't mean you probably wouldn't believe that, oh, a man's looking for a man to, it's not part of medical,
Mm,
it's not part of medical training to change that
it's
idea,
true.
right?
Yeah.
Though of course we're trained, the practices, because it affects the health of those we treat, we don't like it, we don't want it, we disapprove of it. But I'm saying when it comes to response, some people are considering, or even if we intervene, for instance, if we report to the police, how would they even respond if anything happens to their husband? There's some women who people can be very interested. Sometimes you intervene and even the woman starts beefing you, like,
Hey,
yes, I
hey,
think
God.
our response is limited, because then again, we can only treat what has happened.
Yeah.
Preventing, the most we do is advocacy, community education. But when it has happened, I think it becomes a criminal case, and there's sometimes limited in how much we can.
So, are there like, say for instance, and I'm saying this, I don't know, but you see something and you see that, oh, this is really, really, this is terrible. This person has done harm to this person. Can you guys go ahead to call the police or something without even if your patient is saying, oh, no, I don't want trouble, I don't want you to say anything, let's just keep it hush hush. Do you guys have that right to call?
To call, do you mean to like report to law enforcement
Yeah,
officers?
report to the police or, I mean,
So for rape, for instance, for sexual abuse, for instance, part of the guidelines for managing rape is to inform um, a law enforcement agency, right? But I've seen cases again and again with teenage rape. I think the case that's coming to my mind now is I think she was like 11. She asked, and then somebody she was going to sell to raped her. Before they came to the hospital, they had reported to the police. In fact, it was the police that brought the girl to us to confirm that a rape had actually happened, which is another problem, which is another funny, another very interesting aspect on its own. But they brought her to us basically to offer, post rape care and to confirm that rape had happened. That was why they brought her. They had already informed the police. But then, in fact, what we heard from even the policemen was not encouraging. Again, um, I don't know. I think culture influences even the way we deliver our professions as well. Because you see, yeah, they're
Yeah.
like, oh, like you said, what was she wearing? Why did she go to his house? Maybe she was enjoying it, and I'm like, for God's sake, this child is 11. Or I think she was 11 or 12 or so. She